Following last week's shocking murder of a healthcare CEO, I think it'd be a good time to dive into why Americans, now a majority, believe the government should be guaranteeing every American healthcare coverage. In fact, there's a new Gallup survey finding that 62% of Americans say that it's the federal government's responsibility to ensure that everyone has healthcare. Now, 62%, that's actually higher than it's been in more than a decade. In fact, large majorities of Democrats have consistently believed that the government should ensure that Americans have healthcare coverage, but in recent years, they've been joined by independents and even Republicans. Still not a majority of Republicans, but a lot more than you think. In fact, currently 32% of Republicans now hold the view that government should provide healthcare coverage. That is up from 22% in 2020. Among independents, it's a clear majority, 65%. That's up 6 points from 2020. Wow. Not only that, but public support for the Affordable Care Act is now up to 54%. Okay, so it's not a surprise that public support for universal health care is now shared by the majority of Americans. Okay, so, but yeah, Jeff. Okay, but what about the poll saying that most people are currently satisfied with their insurance company? Well, here's the thing. Yes, sure they are until they actually go to use it. See, that's one of the problems, right? So if you haven't had to use your insurance, then you're going to be like, yeah, of course I'm satisfied with it. Yeah, I pay my premium, because generally if you can, pay the premium, then most time you'll be able to afford that premium. Or a lot of times you get your insurance through work, right? And that's the other thing, right? So you get your insurance through work, your employer actually covers a portion of that premium, and then you pay the rest. So it's actually not too expensive. Okay. But again, the problem arises when you actually go to use that insurance. So when that happens, well, you start not being so happy with it. Okay. In fact, when you actually do have to use it, it turns out they're like, oh yeah, no, that's actually kind of poor. And of course, the reason is that they run into denial of claims, they run into massive amounts of paperwork. You have to spend hours on the phone to get approval for procedures and treatments, and you're basically trying to fight for your life. Okay. And look, if you don't get those treatments, if you don't get that medication in time, then, well, you end up dying. And then your family will get flipped off by people who work at the health insurance companies. And in fact, there's an example of this. Back in 2010, HuffPost reported on a story about Hilda and Krikor Sarkeesian and their 17-year-old daughter, Natalie, who was denied a liver transplant by their health insurance company, Cigna, and ended up dying as a result. Okay, so she didn't get approved for that liver transplant in time and ended up dying. Now, the parents, understandably, very upset. They went and protested outside of Cigna, their headquarters in Philadelphia, to try to speak to the CEO at the time, to demand an apology for allowing their daughter to die because they wouldn't approve her transplant. So now she went there. She didn't meet the CEO. She ended up, they ended up getting met by security as employees heckled them from a balcony. One man even gave them the finger as police escorted them from the building. Remember, this is a family who faced massive tragedy, lost their daughter as a result of the executives pinching pennies, okay, and not covering this very necessary to save someone's life surgery. Oh, too experimental. Yes, that's it. They reversed course after some protests, but again, it was too late. She was denied, and she ended up dying. These are the death panels Remember when Republicans talked about death panels when it came to universal health care? Okay. Oh, see, you're gonna put the American people are gonna have to face the death panels, you see, and they're gonna make the decisions whether you live or die. We currently have death panels right now. The companies are the death panels. We have them. Uh, it just so happens that these death panels encourage denials of care. Okay, because they save money. They make money when they deny you care. They take your premiums for years, and then when you need it, they deny you the care because it's profit. And understand that that's what happens when you privatize public goods, like healthcare. Okay, so those of us in America, we know this because we have lived this. But people in other countries, I know I get a lot of international viewers, and y'all are like, "What are you doing over there in America? This is crazy." Well, yeah, but it's important to talk about it because guess what? Other countries, you have politicians in Canada and the UK that are trying to privatize your systems to Americanize them. This is why it's not a good idea. Okay, so this is why privatization is bad, and I'm going to show you more examples of that. By the way, earlier this year, a study led by the University of Oxford. This is researchers there, and this was published in the Lancet. They found that privatized hospitals actually led to worse care. Once again, big shocker, right? Oh my God! Do you realize that when you privatize hospitals, you end up actually costing people more and having worse care? Yeah, no kidding. Key findings in that report found that increased privatization generally correspond with worse quality of care, with no studies included in the review finding unequivocally positive effects on health outcomes. So worse outcomes. Great. Hospitals converting from public to private ownership tended to make higher profit, but was mainly achieved by reducing staff level and reducing the proportion of patients with limited health insurance coverage. So they end up dying or getting offloaded onto the public system. Great. Privatization also generally corresponded with fewer cleaning staff employed per patient, which meant higher rates of patient infection. And in some studies, higher levels of hospital privatization corresponded with higher rates of avoidable death. Yeah. So, big shocker, right? According to the researchers, the results challenge the theory that privatization can improve the quality of healthcare through increased market competition and by enabling a more flexible patient-centered approach. Now that's hospitals, right? Insurance, of course, I think is worse because what insurance companies are just literally a middleman that extracts profit and might actually kill your family, by denying them necessary health care. And that's if you're lucky enough to even afford the insurance in the first place. If you don't have insurance, then it's even worse. Okay. In fact, one person on Facebook wrote of one of the leading insurers. This is United Health Group. Quote, the company put multiple of my family members in debt that they will be paying for the rest of their lives and denied care for my uncle, which led to his death. Yeah. And if they don't die, they go bankrupt. In fact, over 1,000 people go bankrupt daily because of medical bills. So this is real. And this is a result of our privatized healthcare system. No other country, okay, has medical bankruptcy like we do, okay? And I know the rebuttal to this might be, but you don't understand, people in other countries with socialized medicine, well, they have to wait. The wait times are so terrible. You know what? The wait times are pretty terrible here too, okay? I know plenty of people with insurance who have had to wait months for a specialist appointment. Yeah, and not just that, but weeks for an appointment just with their provider. And I'm betting most of you are aware of this as well and know someone who's had to wait or have had to wait yourselves. Now, there's no official tracker to how long people have to wait. Nothing official anyway. But there is an Axios Ipsos survey last month that found that nearly 1 in 5 respondents said they had to wait more than 2 months to see a primary care physician or specialist, with waits trending longest in the Midwest. So here in this country, where we have private healthcare, which is supposed to be like, oh, it's supposed to reduce inefficiency and actually be more efficient, and then low wait times. No, we don't have low wait times. We have incredibly long wait times. In fact, ECG management consultants had actually looked into this as well. They used secret shoppers, right, to measure average wait times for new patient appointments in 11 medical specialties in 23 metro areas. They found that the average wait time for the third next available appointment was 38 days. Wait. What do you mean third next available appointment? What does that mean? Well, basically, it's a common metric for patient access that reduces the effect of late cancellations and other anomalies. Because sometimes, you got to cancel appointments. Sometimes you can't make it. That does happen, right? But, they factored that in and still found that, okay, 38 days. 38 days. It's over a month. AMN Healthcare's 2022 survey of physician appointment wait times and Medicare and Medicaid service acceptance rates showed that the average wait time for new patient non-emergent appointments across 5 specialties was actually 26 days. That was in 2022. That was up 8% from the last time the survey was conducted in 2017, and up 24% from when the survey was first done in 2004. So now, of course, some people are saying, well, that's because you have more people that are needing services. So, and I'll point out too that there is a provider problem. There's not enough providers, not enough doctors. I get that. Maybe that's got something to do with our privatized, college system, where it's really, really expensive to be able to get a degree and become a doctor. It takes a lot of money, a lot of years trained to become a doctor. And so not a lot of people are taking that expense. And you wonder why. And so that's having impacts all across, all the way down the health field to, now we have really high wait times. So that's another reason why privatization is a terrible idea. So, look, when it comes down to it, we pay more than any other country on the planet for healthcare, okay? And we still have massively long wait times. And at the end of the day, we actually have worse outcomes. That chart shows life expectancy versus how much we're paying for this, okay? Versus all these other countries. And you can see the United States, most expensive, worst outcomes. This is the result of our privatized healthcare system, which is nothing more really than wealth care for these CEOs and executives. Okay, so what's the solution? I think it's pretty obvious. Medicare for all. Expand traditional Medicare. Not only just give it to everybody, okay, regardless of your income, who you are, whatever. Truly universal system, right? Not just expanding it to everybody, but also to expand what it covers. Okay, make it comprehensive. Include vision, include dental. Turns out teeth are not just luxury bones, and you do need eyes. Okay, so you need to see. Those things are very important. You need to hear, hearing as well. Okay, expand all that. We know what the problem is. Privatized healthcare. Okay, profit motives. And we know what the solution is. Medicare for all. It's very, very simple. But unfortunately, even though there's a simple answer to this, getting that simple answer enacted is a lot more complicated. Okay, and the reason for that is politicians that get paid off by health insurance companies. Okay, United Health Group since 1998 lobbied over $100 million, meaning they went to our politicians and they gave them $100 million. Okay, to do what? to vote against universal health care, to vote against a public option, to vote against Medicare for all. Okay, that's it. And those politicians also, in taking that money, have decided, oh, we're going to try to figure out a way to sell you a reason why we have to not only prevent you from getting healthcare, okay, a government option or even a public option while keeping private insurance, okay. Not only are we selling you that, but we're also going to sell you a reason why we're going to have to cut Medicare. That's the reality of the system. It is absolutely corrupt. And that's what privatization leads to. Worse outcomes, okay, more expensive for the average person, and legalized corruption. Thank you for watching. If you enjoyed this video, please like, share, subscribe, hit the bell icon in order to get notified whenever a new video is released. And if you want to support independent, progressive media through this difficult time where it seems like everybody is shutting down, you can become a member on our YouTube page, you can become a subscriber on Facebook, or you can go to my Patreon. It's patreon.com/Jeff Waldorf. Thank you.